Whenever you have a medical emergency in New Hanover County and call 911, the finest team of paramedics will be showing up to give you the best care until you reach one of our hospitals. But what happens when they're in need of care? As you prepare to choose your area of ministry here at New Hanover, this video will help you see and understand what ministry in the emergency transport services looks like. Paramedic, defined as a specially trained medical technician licensed to provide a wide range of emergency services in the absence of a physician before and during transportation to the hospital. According to the research done by Francine Grevin, paramedics show the highest rate of burnout among all other healthcare professionals due to the dealing with life and death emergencies in hazardous environments and chronic exposure to human tragedy. The high rates of stress lead to burnout, drug and alcohol abuse, work-related and family-related problems, as well as suicide. In his article about PTSD and paramedics, Drewitz Chesney explains that paramedics experience higher rates of PTSD than police officers and firefighters. Mental health and spiritual care in emergency services is not common, but in the last few years has had more awareness due to the increasing number of suicide in the profession. Most of the time when there has been a tragic call that emergency responders are involved in, a local pastor will be called in to talk to them. Because emergency service personnel are a very tight-knit group and they share similar experiences, they tend not to want to accept outsiders, especially in the time of crisis. Because of these facts and watching their own paramedics suffer even to the point of suicide, the New Hanover Regional Medical Center Emergency Transport Service Administration decided they needed to do something to help their paramedics better deal with the stress they faced each and every day. In 2011, they, in conjunction with the Spiritual Care Department and other EMS chaplains in the state, hired a chaplain to walk alongside the staff as they care for patients every day, not just to come in during times of crisis, but to develop deeper, more meaningful relationships. Ministry looks quite a bit different than other chaplain positions at the hospital. Instead of ministering to patients, which does occasionally happen, most of the ministry of the chaplain is with the staff. The beginning of the chaplaincy can be a difficult one, trying to get the paramedics and EMTs to allow you into their space, attempting to build a rapport with them. This can be accomplished by riding along with them on the truck or interacting with them down in the EMS radio room as they come into the hospital on every call. But what does ministry look like riding along in the truck or in the radio room? If you have ever been around emergency personnel long enough, you will find they have plenty of stories they carry with them. Each call they go on involves a patient with a story, and that patient's story affects the life of the paramedic in some way. Whether it be a patient suffering from suicidal ideations, or a homeless person just looking for a place to go to get out of the rain, or a cardiac arrest, or even the death of an infant, each call tells a story. One of the metaphors for ministry in Dykstra's book, Images of Pastoral Care, references the art of storytelling and story listening. Ministering with the paramedics isn't making up stories to make a point, but rather listening to the stories they bring and help them share things that are bothering with them and be able to connect with them empathetically. If you have experience in their field, it can also help to share your own stories about your experiences to help them see positive and negative ways to deal with the issues they face. Giving care to the paramedics actually looks very similar to how they offer care to their patients. Before giving treatment to their patients, they will usually ask a sample to learn about the patient's story of crisis at this moment. They want to know the symptoms that they are feeling, allergies to anything that would make them worse, medications that they are on to treat the symptoms already, past medical history, the underlying issues that could have caused this. last oral intake, and the events leading up to the injury. Your sample won't look exactly like theirs, but it does address some of the same basic things. First, symptoms. How did this story make them feel? Angry, upset, depressed, afraid? Allergies. What methods of care is not going to be helpful for them? Maybe prayer is not something that is helpful for them, or maybe they aren't ready to talk about it, but just sit with it for a while. Medications. What are they taking to cope with what they are feeling? Alcohol, drugs, looking for love in the wrong places? Past history. What are the past stories that have gotten stirred up? This is the biggest piece of the ministry puzzle that takes the most time to get to know about the paramedics, especially since there are so many staff and not enough time to get to know each one of them on a deeper level quickly. What has the paramedic been through that has helped make this call significant in their life? Do they have small children at home? Are they going through a nasty divorce and custody battle? Do they already suffer with PTSD from military experience? Have they had a death of a close family member or friend? Trust must be developed before they are willing to let you know about these things. Last oral intake. How did they handle the last call they had like this? And events leading up. What other current stories are they carrying with them? Has this been the second or third death for them today, this week, this month? Did they just have a fight with their family member? Or did they receive a bad evaluation from a supervisor? Most times when something traumatic happens, a critical incident stress debriefing should be set up to help the staff work through what has just happened. One of the first things participants are encouraged to do is to tell their story, giving a detailed account of step-by-step what they did during a call and how it made them feel. This allows them to talk about it with people who understand and who went through the same experience, and begin to work through those emotions that they are experiencing. Stories not only come just at critical incident stress debriefings, but in the EMS radio room, monthly staff meetings, and ride-alongs on the truck. At least once a year, the administration leans on the chaplain to lead a staff meeting highlighting PTSD and the stress that paramedics face, allowing paramedics to share their stories and give positive ways to reduce stress as a result of their job. While paramedics don't have much time for talking due to having to get back on the road, helping them make their stretcher beds, restock their truck, and walking down to get a snack allows for stories to be shared while ministering in the radio room. These stories are about the patients they have just picked up, how good or bad the day has been, or things that are bothering them. More time is available during ride-alongs with the staff, getting to know more about who they are personally. Who are the people most important to them in their lives? What does home life look like for them? There's usually enough time for the chaplain to share their stories with the paramedics as well, to help them begin to build a relationship of trust, so they will be more willing to seek the chaplain when they need them the most. Even though both the paramedic and the chaplain come with different stories, there will be some days when they create stories together, coming to the aid of a patient whose story leaves a lasting impact on all involved. And those days will be the most challenging and most rewarding days of your ministry.